Welcome to the Specialty Collective, where we bring in some of America's top specialists to give you the inside scoop on their field. Today, we're discussing dermatology. I'm Dr. Jay Feldman, and I have with me, I'm honored to have Dr. Mudgil.
Honored to be here.
Board-certified dermatologist, dermatopathologist, AKA the Gary V of dermatology.
Yeah, it's too kind, man.
Thank you so much for joining me.
It's good to be here, man.
Thank you so much, and let's just go right into it.
All right,
Tell us a little bit about dermatology.
All right, so I have been in private practice in New York City for 10 years. Tomorrow will be the 10-year anniversary of my practice. I trained in New York City at Mount Sinai, and I have a practice where we see kids, I see adults, we do a lot of cosmetic stuff, a lot of surgical stuff. And that's the beauty of dermatology. It's such a vast field. You can pretty much do anything that you want in the field of dermatology. So I have a lot of medical practice, I do a lot of cosmetic procedures, which we did a few today together. And I do in-office surgeries like cysts and lipomas. So it's always fresh and every day is different and it makes it a lot of fun. And a big part of my practice is dermatopathology, where I'm actually the guy who's looking under the microscope and making diagnoses, like diagnosing skin cancers and rashes. So I kind of split my time between the two, and like I said, every day is different. That's what keeps things exciting and fun for me.
That's what I'm looking for too, something that you're not doing the same thing every day.
Totally.
So tell me, why did you choose dermatology? Why did you go into this?
It's a good question. So when I started medical school, I come from a family of doctors. When I started medical school, I actually wanted to go into OBGYN. I just liked that excitement. I thought delivering babies would be a lot of fun. And everyone in my family, my brother's an ophthalmologist, my mom's an internist, they said, probably, it's great if you want to do it, but you really got to consider what your life is going to be like 10, 20 years from now when you have a family. Do you really want to be going to the hospital in the middle of the night? So there was something called the road that I think it's probably still applicable, of like fields that in medicine that are great fields and are like lifestyle conducive. Mm-hmm. So ROAD is an acronym for radiology, ophthalmology, anesthesiology, dermatology.
Never heard that.
And radiation oncology is another one.
Yeah.
So my brother, he's 7 years older than me, he had just gone through residency, and he was actually, I guess he had finished his residency, was starting to work as an ophthalmologist. He said, you do what you want, but maybe you could consider some of these fields. So between my first and second year of medical school, I actually did something called, what did I do that year? I did some derm path research, just randomly. And I was like, oh, this seems pretty cool. And between my second and third year of medical school, I did a Howard Hughes fellowship, where I took a year off from med school and I did research. And the research happened to be in skin cancer.
Yeah.
And then, I really got interested in dermatology. That was a pretty pivotal year for me. And I knew that's what I was going to do. It's like a tough field to get into.
Yeah.
Everything kind of fell into place, and I ended up at Mount Sinai, and the rest is history.
That's amazing.
Yeah.
So, like you said, it is one of the most competitive fields to get into, and you said you did a 2-year research.
Yeah, I did 1 year of research in derm path, and in dermatology rather, it was skin cancer research.
Before your residency?
Before my third year of medical school, actually, I took a year off.
Gotcha.
And the Howard Hughes Fellowship, if you're not familiar, is like, it's kind of like the Rhodes Scholarship of medical school.
Wow.
So it's a pretty prestigious fellowship, and kind of just doing that kind of opens up a bunch of doors.
Yeah.
And my research actually was very well received. I ended up winning a scholarship for the rest of medical school, paid for by Howard Hughes, and that really was very helpful for me. I mean, I did very well on my boards and in school as well, but that was opened up a lot of doors in terms of like residency opportunities and stuff. So derm is one of those fields, I would say, like if that's something that you think you're into, you got to kind of hustle. Start your hustle early to get your foot into the door, because it's very helpful. There are many people who get into dermatology by doing research after medical school. Like there's a lot of residency programs have something called Dermatopharmacology Fellowship, where you spend 1 or 2 years working on like new drugs and stuff that are coming out with clinical trials, and then that's kind of like a way to get into dermatology as well. So
that is something that's expected from dermatology programs, is some sort of research beforehand.
Some sort of commitment. I would say what you've shown towards dermatology. So most folks did do research.
Yeah.
Something related to dermatology, whether it was in summers or a year off.
Yeah. Well, you're way too humble. Congratulations on getting that research fellowship. That's amazing.
Thanks. It was a great experience.
Yeah. So tell me a little bit about what is a typical day in the life of a dermatologist through residency, and now that you're a practicing doctor, what do you do day to day?
Yeah, so every day is different, like I said. So on Mondays, which is, when you're in private practice and academic, it's also a little bit different. So as a private practice dermatologist, I kind of like cram a lot into short periods. So I have 2 offices, one in New York City and one in Long Island. So my day typically starts very early in the morning. On Mondays, I probably get up in the 4s, and my lab tech works overnight. So I pick up my slides, I come to my New York City office, and I'll read slides for an hour or two before I start seeing patients. And I'll see patients from 9 to 12 in New York City, and I'll grab a quick lunch after, head out to Long Island, and I'll see patients from 4 to 7 in Long Island. Typically on a Monday, I'll see about 60 patients, 30 in each office, and I'll read probably anywhere from like 50 to 100 pathology slides.
Wow. So how about, tell me a little bit about the pathology that you see, the procedures that you do. What does that Monday consist
Yeah, so
of?
Monday is like, it's a crazy hustle day because my head's basically spinning because I'm doing so many things. But I like to start my week off like that because it gets my head in the right space for like anything that's coming in the week, so I kind of just dive right in.
Yeah.
So I'll come in, I'll read slides, and for that's basically diagnosing skin cancers, benign skin lesions, moles that are biopsied and that sort of stuff. And then when I start seeing patients, it's a mix. I'll see, you spent the morning with me, so you kind of see what we do. I did, it'll be a mix of cosmetic procedures, so Botox and fillers and laser procedures. I do a lot of PRP injections, a lot of just acne follow-ups. Yeah. So I have a lot of patients who come in, like men and women, young folks and older folks that come in for acne, and we have various treatments that we do for them. Predominantly just reviewing their prescriptions, doing blood work, that sort of stuff.
Yeah.
And then it's like random rashes that come in, like drug rashes or allergic contact dermatitis, perioral dermatitis, all kinds of stuff. You never know what's going to walk through the door. Yeah. And then some patients come in, they want to get some lesions removed that are bothering them. It's a big mix.
Yeah, that's true. And even just being here this morning, we've seen a whole range of things from clinical skin conditions through several different cosmetic procedures. It was a blast.
Yeah, man. That's my every day is like that. Yeah. And then I'll go to Long Island and I'll basically do the same thing.
Yeah.
In between, I do a lot of social media stuff and a lot of filming for Instagram and YouTube and that sort of stuff. So typically, when I get back to my Long Island office, my media team, the Mudgil Media Mafia, is there working on stuff, and then we'll typically film something quick, or we have a TV show that we'll film a segment for. So this Monday we filmed a segment for the TV show before I started seeing patients. And then round 2 of seeing patients, which is the same thing, a mix of medical, surgical, and cosmetic stuff.
So tell me a little bit about the subspecialties of dermatology. I know we talked about the fellowships, but for the people interested in dermatology that might be thinking, oh, I want to be a Mohs surgeon, or I want to do surgical dermatology, what do those consist of and what do they do?
So those are typically 1-year fellowships after residency. And Mohs surgeon, so Mohs surgery, if you're not familiar, is a specialized surgical technique where it's a tissue sparing surgery for cosmetically sensitive areas like the face, specifically the nose, the ear, around the eyes, where it's really tissue preservation is key. With Mohs surgery, you basically take the smallest margin of normal skin around the tumor. So if it's a basal cell, you'll take a rim, you'll look at that tissue under the microscope right then and there while the patient waits. If you identify a positive margin, you go specifically to that spot and remove another margin of tumor from that area. Then you review the slides to make sure that the margins are clear. So you're basically removing the smallest piece of skin, looking at it under the microscope, and ensuring you have clear margins without removing a very wide margin of normal skin. So that a Mohs surgeon's day is typically either that all day long.
Yeah.
But a lot of Mohs surgeons will kind of do a mix of stuff. So most of the Mohs surgeons I know will do like 1 or 2 surgical days where they're doing Mohs surgery either in the morning or all day. And then Mohs surgeons are very well trained in cosmetic procedures as well. So they do a lot of lasers and fillers and Botox and that sort of stuff. Most of the Mohs surgeons I know basically kind of split their time between Mohs surgery and cosmetic procedures. Some of them will also do some medical dermatology like skin checks, skin cancer screenings, and that sort of stuff, which is also a big part of my practice as well. But yeah, it's a great field if you're surgically inclined. If you love doing surgery, it's a great field because you do tons of surgeries every day. And every Mohs surgeon I know is pretty psyched to be a Mohs surgeon.
Yeah, my grandma always told me to be a Mohs surgeon, I guess, in
Florida.
Boca. Yeah, it's a big thing, a lot of skin cancers and stuff being removed.
Yes, absolutely.
And you're a dermatopathologist.
I'm a dermatopathologist, which most dermatologists actually hate. So most derm residents, like derm path is like the thing that they just hate the most, but you have to do it because there's a significant part of derm path on the derm boards.
Yeah.
I always liked it. I love, like we were talking about this earlier, I love pace. So I like seeing lots of patients in a short period of time. I like reading a lot of slides in a short period of time. Like, intense focus for a short period of time is like my forte. So derm path is perfect for that. You have a slide in front of you. It's like 30 seconds of intense focus, identifying what the diagnosis is, and then you move on to the next thing. I'm not the type of guy that loves long surgical procedures, like what Mohs surgery is, or my brother's an ophthalmologist, what ophthalmology is. I don't really like doing something for like multiple hours at a time. I just like to kind of quickly, it's basically having like 100 wins a day, like
Yeah.
I'm looking at 50 slides, that's 50 wins. I'll see 60 patients, that's 110 wins in one day,
Yeah, it feels
That
good.
to me-
Identify the problem like that.
Totally, man.
It's great.
Yeah, so that's my mindset. That's the way my mind works. That's what I
Yeah.
love, just having like lots of wins. So like, getting a lot done. Basically.
Who doesn't like winning all day,
Yeah.
every day?
Yeah, that's it.
It's awesome. And you said there was a third fellowship?
So there's a procedural dermatology fellowship, which is basically a mix of Mohs surgery and cosmetic stuff. That's a newer fellowship. So those docs typically do the things that the Mohs surgeons would do.
Gotcha.
Yeah.
Cool. So my next question is usually how competitive is dermatology and what are the scores? But I guess you've been kind of in it for a long time.
Yeah, I did residency. I graduated residency in 2006, my fellowship in 2007. But I'll tell you, the standards really haven't changed. So it's basically like, very high board scores and really good grades. So almost every derm resident's AOA.
Yeah.
Which is like the Medical Honor Society, and most of the derm residents have like in the high 90s percentile board scores.
Yeah, I think that's the same. There's a research kind of standard that's met.
Right.
And then the high board scores, 250s.
Yeah.
And obviously the other extracurricular stuff that you've done and the interest in dermatology early.
Totally. And that being said, if you have like not 200, 250 board scores, you can still get into dermatology.
Yeah.
Just, shouldn't be discouraged. If there's one thing that's lacking, you can certainly compensate with great research or great clinical exposure. So if that's what you want to do, you can do it. There's a way to do it, but you may have to do a couple of extra years of research, whatever the case is, but it's worth it if that's what you want to do, right?
Yeah,
there's nothing worse than going into a field because you feel like that's what your board scores or what your academic qualifications at that point kind of set you up for.
Of course.
Because the rest of your life is going to suck. Life is long,
Totally
so you
agree
can
with that
put whatever
statement.
hustle you need to do, whatever you need to do. It's just everyone's hustle is different,
Absolutely. And couldn't agree with that statement
Yeah.
more. Like finding a field that's right for you, not because of what your board scores tell you to do.
Exactly.
You have to try and find a way to make it work for you.
Yeah, because there was a few non-traditional students in the Sinai dermatology program when I was there. And
Yeah.
yes, they're dermatologists today just like me, so it
Yeah.
doesn't matter what
we
road
had,
you take to get there, man.
I think I'm in osteopathic school, and we had one kid who matched into dermatology it's a very MD dominant field. So we were all very impressed with him, but he worked his ass off. He was rotating all over the country, living out of a backpack, and he has psoriasis, so he was super interested. He's been doing research, but it's an uphill battle, I want to say, for all the DOs out there, but it is possible. We have people that have done it.
Yeah,
That's great.
Yeah, I know a few osteopathic dermatologists practicing here in New York City. Yeah.
That's awesome. Okay, so now a little bit more the good stuff, the juicy stuff about the specialty that a lot of people want to hear, and they read the charts, the salary, compensation, lifestyle. Tell us a little bit about what it's like financially to be a dermatologist and what you can do.
So it all really depends what you do, right?
Yeah.
So I mean, dermatology is a well-compensated field. Most dermatologists don't work 5 days a week or 6 days a week, but you cram a lot into the time that you're working. And in terms of like the ceiling is as high as you want it to be. Really, it just depends how much you want to hustle. So it is a lucrative field, particularly if you're doing a lot of cosmetic stuff, because cosmetic stuff is fee for service. You're not really dealing with insurance plans. A lot of the dermatologists that are exclusively insurance-based practices also do very well, but they see a gajillion patients a day. So it depends what you want to do. Insurance reimbursements for every field are coming down. That's just the way the culture of medicine. So every year it's different. Medicare has new rules. So it depends where you practice. Like in New York City and Manhattan, there are a lot of dermatologists that don't take any insurance. Like patients will come even for their medical issues. And we have a significant portion of my practice here that's falls into that demographic. Whereas in suburban areas like my office in Long Island, there's less of that. It's just a different demographic. It's a more insurance-heavy practice. But interestingly enough, I do a lot of cosmetic procedures in Long Island because there's not a lot of dermatologists that do that stuff out there. So you kind of got to find what you like to do. For me, like I said, I love to do like a mix of stuff. The lifestyle of dermatologists, everything they say is true. It's awesome. I love it. I can be as busy or not as busy as I want. There's a lot of flexibility, particularly when you have your own office. Like if my kids are off from school or have an event at school, I have the luxury of, just shuffling my schedule around to be there. Or if I want to go away with my wife or whatever the case may be, there's always, you can work your schedule. It's like I'm not married to a hospital. There's a lot of flexibility, which is important for just quality of life.
And this is no surprise. We all have heard that dermatology is an awesome field to be in, both financially and for your lifestyle. So that's awesome. It's really awesome.
Yeah, I'm very happy with my choice.
So talk to me a little bit about, you mentioned you wanted to be a gynecologist at one point, which I know is one of the most heavily malpractice, lawsuits, specialties.
Yeah.
And that's become a bigger and bigger concern as a lot of these, not just frivolous, but just lawsuits in general start to happen against doctors.
Yeah.
And really like wears down at them. Do you experience any of that in dermatology? Have you ever?
Yeah, so derm is, if you're a surgeon, so most surgeons have a lot more exposure for malpractice stuff just because there's more complications with surgical procedures. So as a clinical dermatologist, of course, you know, there's risk. As a pathologist, there's risk, but the malpractice actually isn't so bad for dermatologists. So it's like obstetricians, gynecologists, orthopedic surgeons, neurosurgeons have like very, very, very high malpractice rates. For derms, it's not on the higher tier. So the malpractice is actually very reasonable.
Yeah. How about you? Have you ever had any scares or?
Sure, we all do, man. Like the longer you're in the game, man, it happens. Yeah, of course. You know, there's basically two types of doctors: those who've been sued and those who are going to get sued.
Yeah, that's funny.
You know, that's just the way it works. So yeah, I mean, unfortunately, knock on wood, I've been okay. But you know, a lot of my colleagues have been sued multiple times, just for things that aren't necessarily even their fault or they didn't do anything wrong.
It happens to anyone.
It's just a very litigious society, and you know, you see those commercials on TV, like, you know, the 1-800-lawyer commercials. I mean, there's a lot of solicitation for malpractice claims.
Oh, yeah.
And you know, I'm a big believer in that there must be reform there, because I mean, it really is pretty much crazy. You can pretty much sue anyone for anything.
Yeah.
Especially in medicine, or if you're a dentist. And you know, a lot of the suits are just things go wrong, and there's certainly very reasonable claims and stuff that are out there.
Yeah.
But by and large, and I would say the majority of stuff out there is pretty frivolous stuff, which is like, you know, it really impacts healthcare a lot, you know, because you want your doctor to be focused on taking care of the patient in front of them, not like frivolous stuff.
They call it cover your ass medicine.
Yeah, and it's a problem for patients, man. It's a problem for doctors. It's just because of the way the society is geared, and you know, I think folks are looking at it more now, and it's being scrutinized a little bit more, but there really hasn't been much reform.
More protection for doctors, I'm with you.
Yeah,
Absolutely.
So that's it. But yeah, it's coming from a doctor, but I think it's for the benefit of the patient.
Yeah. Follow up. If you could go back and do it all over again, would you choose dermatology? If not, what would you choose?
1,000%, man. I would do exactly what I'm doing now. It's, you know, sometimes I pinch myself. You know, like I love what I do. And the life that I have is something that, you know, I dreamed of having, and it's crazy because I feel like I'm living my dream. So I would do it in a heartbeat. I would do the exact same thing again.
Yeah, that's awesome.
Yeah.
I hope everyone can feel like that one day, but
Everyone should feel like that, man.
Yeah.
You know?
So this one's going to be a little bit of a challenge.
Yeah.
If you could recommend any specialty to a fourth year, third year medical student other than dermatology, what would you suggest they go into today?
That's a really tough question, like you said. You know, I mean, it all depends what you love to do. You know, so we were talking earlier, for me personally, I don't love long procedures.
Yeah.
You know, I have a little bit ADD, you know, so I like to kind of, you know, just focus on something that's, you know, right in front of me for a short period of time. That's where my mind works the best, and I'm the happiest. We're all different, you know, and now the way medicine is working, like for instance, you're going to family medicine, but you know, that can mean 1,000 different things, you know.
Absolutely.
There's family docs, like we were talking, that do like sports nutrition, or, you know, fitness stuff, or deliver babies, or, you know, or see kids only, you know, it's such a, or do HIV medicine like the doctor we just met. I mean, it's so vast, and it's kind of like a loaded question, because dermatology is right for me, but you might hate it. Like some of my doctor friends, like, oh, I could never do that. It's like, you see all this gross stuff all day.
Yeah.
You know, like I'd rather just be a radiologist and look at film, and it's a clean field, you know? So it all depends like what you love, man. For me personally, there's nothing else I could imagine doing. I mean, if I were, sometimes like the thought of being like a plastic surgeon appeals to me.
Yeah.
Because I do a lot of cosmetic procedures, and like sometimes I feel a little bit limited in like the scope of what I could do.
Yeah.
I have a very aesthetic eye, and like, you know, to be able to like do whatever procedures that plastic surgeons do, you know, there's a little bit of like, you know, I'm a little envious of that, you know. But that's me, you know. So I wouldn't say I'm very happy being a dermatologist. It's not that I want to do something else, but looking back, that's a field that I could have potentially explored more. You know, knowing what I do now.
Yeah.
I didn't know I was going to be doing so much cosmetic stuff as a dermatologist at the time.
Yeah, and there's a lot of crossover and similarity.
Totally. But listen, I'm sure there's plastic surgeons that look at derms and be like, oh,
Yeah.
I wish I did that. You know, so it's just the way it works, man.
Yeah. So here's a fun one for you. This is going to be the final question. And you know how every specialty kind of has their own stereotype that you look at when you're going into something,
Yeah.
you know, the orthos or the bros, and you
Yeah.
know. What is that for dermatology? Tell me about the stereotype.
The stereotype for dermatologists is like when you're going to do consults on like in the hospital when you're a resident, you'll be showing up in like your Louis Vuitton bag and your Gucci shoes, and which is actually pretty true because it was pretty funny when we were derm residents at Sinai. We were pretty fancy. Yeah.
So you had your Louis Vuitton shoes on?
Well, I didn't at the time, but some of the residents, you know, would have literally their consult bag was like a Louis Vuitton bag. So, you know, the reputation that derms are fancy, I think, is kind of true.
Derms are fancy, I love it.
What can I say?
That's the field, and we all have our thing.
That's it.
We all have our shtick. Dr. Mudgil, thank you so much for joining me.
This is awesome, man.
Yeah, if you had one final word to say to anyone who's looking into dermatology, what would you give them?
I say if you want to do dermatology, it's an uphill battle, but it's so worth it, and you know, just gotta fulfill your dreams. If that's what you dream to do, then do it, because you know, the only thing stopping you from doing it is you.
Thank you so much for tuning into the Specialty Collective. If you enjoyed this video, please watch our other ones. I think everyone should watch every one of these videos before they pick a field to go into, just so they can hear a little bit about it from, you know, the leaders in their field before they make one of the biggest decisions of their life. Dr. Mudgil, thank you again.
That was awesome, man.
Again, the Dr. Gary V of Dermatology.
That's very
Thank you so much.
Love this, man. Thank you. Good stuff.